Hi everyone, welcome back to another episode of Makeup and Wake Up. I am very sorry I did not upload this video yesterday like usual. Usually upload these videos on Wednesday, but I needed to take a personal day yesterday. But everything is all good. I am very excited to get into today's video. But before I do that, I do want to let you guys know that moving forward, this series is going to be every other week. So instead of uploading a Makeup and Wake Up every week, I am going to be transitioning to every other week. I really like this series. I love making these videos and I love learning right alongside of you guys. But these are heavy topics. These videos are very time consuming. And my channel is beauty first, and I feel like this series, although it's important and I'm really enjoying it, this series, having it be every week, puts a lot of restriction on my week to film and produce other beauty content. Moving the series to be every other week will allow me to take breaks and also allow me to create more quality content overall between my actual beauty content and this Makeup and Wake Up series. So I think it'll be better for everybody. So today's video is all about racism in healthcare and bringing awareness to the fact that health justice is racial justice, and racism within our healthcare is especially concerning because we are currently in a pandemic where marginalized groups are being disproportionately affected by COVID-19. So I typically start out my videos by giving you guys a little bit of history. So when the Civil Rights Act in 1964 was passed, it did include a clause that made it illegal to discriminate on the grounds of race. And I want you to think about that year, 1964. That was not that freaking long ago. That was less than 100 years ago. People that were around in 1964, around the Civil Rights Act, are like still alive today. But in a lot of southern states like Mississippi and Alabama, they fought against that portion of the Civil Rights Act, saying that their states had the right to run their services without interference of the federal government, and they genuinely believed that segregation of healthcare was necessary. And you know, it's important to acknowledge the fact that this did not happen that long ago. The people that were fighting in these southern states against the Civil Rights Act to continue having segregation of medical practices because of race, because it's necessary, that's messed up. And the problem with this institution is it never really changed. This is a perfect example of what it means to have ingrained racism within an institution. Healthcare in America has inevitable ingrained racism within it because of its history. Stuff like that does not go away overnight, especially when healthcare systems and other institutions are built on racist values. The healthcare system doesn't just stop being racist when they decide to desegregate it. Obviously, when you have the southern states fighting back. I do want to mention an amazing podcast that I went ahead and listened to in preparation of this video. It is called The Praxis, and I really think that it is an important listen for anybody in the medical field, anybody in any institution with ingrained racism, anyone wanting to just learn more. It was super insightful. Basically, the first part of the podcast was the host having a open conversation about racism. And then the second part of the podcast was interviews and discussions with healthcare professionals on racism in healthcare. So it was an amazing podcast. I really recommend listening to it. And it's not that long either. It is a short series podcast, which are arguably some of my favorites. So a really hard to swallow fact is that Black Americans have the shortest lifespan compared to other ethnic groups. And this is a result of having higher rates of chronic illness, not having access to proper health care, and a higher likelihood of being uninsured. And if it's not clear enough to you that racism is involved when a marginalized group, a very large marginalized group, has the shortest lifespan in America, to understand how racism is involved in our healthcare system, we have to acknowledge the fact that statistics like that happen as a result of centuries of oppression and abuse towards marginalized communities. Black Americans and marginalized groups have a socioeconomic disadvantage compared to white Americans. Implicit bias obviously plays a huge role in this. People of color oftentimes do not receive the same care as white Americans. And physical and emotional pain is often overlooked in people of color, and as a result, it's super common for pain to be misdiagnosed or even overlooked. Up on the screen, I'm showing you guys a page from a textbook from 2017 that is literally trying to show students and healthcare professionals how pain is perceived by different cultures. And like, what's the purpose of that? And that type of teaching and ingrained racism within this institution really does contribute to marginalized communities and people of color being treated much differently in a medical practice. It really does prevent a healthcare provider from being able to properly treat people of color as humans with pain, and as humans with the ability to notice when their body is in pain. And that is a health concern, that is a health crisis. Also, more interesting is the fact that white and Christianity is not in that textbook page. So we have to ask, is that textbook trying to say that whiteness and possibly Christianity, the culture of it, is the standard? So I'm going to share with you guys a story that a doctor had shared about a patient experience. So this patient, a black woman, had a pretty serious painful health condition, and she went to the emergency room and she was in need of pain medication because she was in a lot of pain. And the emergency staff not only took it upon themselves to not provide her with the pain medication to help her cope with the pain that she was experiencing, they created a narrative in their head that she was going to the emergency room because she was trying to take advantage of them to get pain medication. They did not want to help her because of the narrative that they created in their head, which is a direct result of implicit bias and is also a direct result of racism being ingrained into healthcare. But they didn't help her, they didn't diagnose her, which is a result of them creating this racist narrative in their head. There wasn't anything in her health record that could have made them believe that she was seeking pain medication for other motives. She never had any issues with substance abuse. This doctor was able to tell her story because this woman was finally able to be diagnosed. But this is not a unique case. This happens all the time in our healthcare system because of ingrained racism and because of implicit bias. So I'm going to talk about a really messed up study that took place between the 1930s to the 1970s, not that long ago. Hopefully I'm saying this college name right. It's Tuskegee. The Tuskegee University took 600 impoverished African American men, and the purpose of the study was to observe the progression of untreated syphilis in these men, but these men were promised health care for participating. So to 600 poor black men, free healthcare sounds pretty good. And the progression of untreated syphilis wasn't really that known to them because obviously they're conducting the study to find out. And like I said, this study started in the early 1930s. 1932, these 600 men were given syphilis and then studied to see what untreated syphilis looked like. But in 1947, penicillin became the standard treatment of syphilis. And even though they had a treatment for syphilis, these men, these 600 poor black men, were still being used by researchers to observe what happens when syphilis goes untreated. Why is that necessary? They were promised free health care, and here it is. Here's a treatment for what they've been trying to observe, and they withheld that antibiotic from them. No care was provided to these men. Obviously, this study went on for far too long. It went on for 40 years. It ended in 1972, even though penicillin was founded to be a treatment for syphilis in 1947. And as a result, untreated syphilis in these men caused blindness, insanity, and really severe complications. So actually, 399 of the 600 men that were used in the study were infected with syphilis. So 201 of those men were not and used as a control group. So the fact that the number of men that were actually infected with syphilis is much lower than 600, that makes the stats that I'm about to share with you even more upsetting. By the time the study officially ended in 1972, 28 of those 600 men had died. 100 more had severe complications to the untreated syphilis. 40 of the 600 men's spouses contracted syphilis, and 19 of the 600 men's children were born with syphilis, and all of these victims were African American. There are many examples of how systemic racism does show up in healthcare. Black moms and babies are 4 times more likely to die during childbirth in the US. Black men are 2.5 times more likely to die of prostate cancer than white men in the US. Even though the Affordable Care Act did reduce the amount of people that were uninsured in America, Black people are still almost 2 times more likely to be uninsured than white people. Black women are also 1.4 times more likely to die of breast cancer compared to white women. Now, a question that you might be asking me or yourself, but doctors aren't racist. It's kind of like saying that not all police are bad. Just because a doctor or a physician isn't being explicitly racist doesn't mean that they don't operate in a racist system. The statistics that I just shared with you are a direct result of racism, and ignoring the fact that it is caused by racism is a part of the problem. Our subconscious prejudices, our implicit bias, it really can affect how a patient is being treated. And because racism and discrimination is so ingrained in our social and political and economic structures in our society, it really does affect everything. And for minorities, this ingrained racism and discrimination affects their ability to have equal access to quality education, quality healthcare, healthy food, livable wages, and affordable housing. To tie this into everything that's happening in current news, COVID-19 is in fact disproportionately affecting people of color. People of color are nearly 3 times more likely to contract the coronavirus compared to white people, and they're 2 times more likely to die from it. 1,000 employees from the CDC actually recently acknowledged the fact that racism is playing a huge role in America's inability to combat coronavirus. And these 1,000 employees wrote and signed a letter addressing the fact that racism within their workplace does a lot of harm to the pandemic, not acknowledging the fact that people of color are disproportionately being affected by COVID, and not acknowledging the fact of why that is happening. Many people of color in America are put in the position where they do have to leave their homes because of the jobs that they have. Many of the privileged people in America are the ones that don't have to leave their house. They can work from home, and they do have access to adequate healthcare. So even though COVID-19 is a threat to everyone, it is in fact hurting people of different racial groups and different socioeconomic groups. So how do we fix this? How do we move forward from this? As a society, we do have to acknowledge the fact that people of color have been oppressed, they are discriminated against, and this is something that has been done for centuries. The institutions that we have in America started by people who believed in segregation. They believed that people of color were not equal to them. They were, in fact, the group of people that put people of color into oppression. And we have to admit that, and we have to acknowledge that in order to move forward and fight for justice and fight for policy change. Whether you are a healthcare professional or not, you do have a say in whether institutions remain racist. We need to speak up, and we need to fight back, and we have to fight against this very broken system. We all have to be advocates for equality in all aspects of life. Every person living on this planet is human. We are all people. Each and every one of us deserve to have access to quality healthcare. And also remember that voting does matter. Making sure you're backing up and supporting politicians who are trying to work towards free healthcare is definitely helpful. That concludes today's episode on racism in our healthcare system. I'd love to make another episode on the injustices in women's health, so let me know if that's something that you would be interested in. Next episode, episode, we will be talking about mental health, which will be a really heavy topic to dive into. And remember that I am moving this series to be every 2 weeks, so I won't see you next week, but I will see you the following week. Thank you guys so much for all of the love and support on these videos. Make sure that you go ahead and like and comment on this video, and always share with your friends. I really appreciate all the support that this series is getting. If you aren't already subscribed, definitely make sure that you go ahead and do that and turn your notifications on so you can get notified whenever I post another Makeup and Wake Up. And I will see you in 2 weeks.